Good morning, and thank you all for your attention. I'm grateful for this opportunity to present my research. There are no disclosures for this presentation. The premise of our research is that based upon the known fact that systemic activation of the immune system during hemorrhagic shock has been implicated in the development of multi-organ dysfunction syndrome. Furthermore, it is also known that tissue hyperperfusion is known to release a series of molecules collectively referred to as damage-associated molecular patterns, or DAMPs for short. These molecules are also sometimes referred to as alarmins because they serve as something of a distress signal between distressed or hypoperfused tissues and the immune systems. DAMPs activate the immune system through a variety of different pathways, some of which are yet to be elucidated. However, one important interface between the DAMP system and the immune system is toll-like receptor 4, or TLR-4. This schematic generalizes the process whereby DAMPs bind to the extracellular domain of TLR4, thereby inducing a rather complex intracellular cascade, resulting in release of inflammatory mediators from that target cell. TAC242 is a drug. It's a small molecule inhibitor, non-competitively binding to the extracellular domain of TLR4, and it blocks this process at the point where the DAMPs bind to the receptor. So we sought to design a study with two basic objectives in mind. One was to determine in a rat model which cytokines responded most to purely hemorrhagic shock, and secondly then to examine the effect of TLR4 inhibition with TAC242 on this shock-mediated immune response. Our experimental design was as follows. We used male Sprague Dawley rats who were subject to sevoflurane anesthesia. During the first portion of the experiment, rats were subjected to a controlled bleed of approximately 50% blood volume as estimated by weight. This was done through a previously implanted jugular venous catheter. Withdrawn blood was mixed with hebronized crystalloid and kept on a warmer for the remainder of the experiment. The animal was then allowed to undergo a period of shock of approximately 70 minutes following resuscitation with the withdrawn blood and crystalloid. After awakening from anesthesia, the animal was then monitored for approximately 48 hours. Experiment proceeded in cohorts of 6 rats with 3 in each arm. There was one cohort that underwent a subgroup that had anesthesia only without shock. Blood samples were taken from the animals through the jugular venous catheter at the time points indicated by the arrows on the timeline. So you can see once at baseline, once during the shock period, and then several following resuscitation. Blood samples were frozen for later analysis, which consisted of a battery of ELISA-type assays for the cytokines and chemokines listed on the screen. This plot here just demonstrates the hemodynamic response to our shock model in a similar cohort of rats. As you can see, there's a precipitous drop in blood pressure during the bleeding phase, followed by partial compensation by the animal during the shock phase, and then a return to normal vitals toward the end of resuscitation. These plots here demonstrate the response to the shown cytokines to our shock model. The horizontal axis represents the timeline that was previously shown, and the vertical axis represents the concentration of the measured compound in picograms per milliliter. As you can see, all animals starting out with a baseline level that is quite low, and then seeing a peak in the level of that cytokine approximately 1 hour following resuscitation with a gradual decay to baseline following that. These plots are demonstrated only for the control animals, and then here are the same plots overlaid with the results for animals undergoing drug administration, and you can see for these cytokines there's a decrease in the level of expression after administration with the medication. This is a similar group of plots with identical axes that are showing the response in the shown chemokines with, again, similar decrease in these levels after administration of the drug during the resuscitative phase. These plots here demonstrate the effect of anesthesia alone as it compares to the effect of shock. For most of the cytokines, including IL-6 and IL-10 shown to the left of the screen, you can see that there's a minimal response to anesthesia alone. However, with several of the cytokines, most notably KC, there was actually a robust response to anesthesia alone that actually is comparable to the effect of shock with TAC administration. This suggests that at least for KC, we're seeing a amelioration of all inflammation due to shock, and the only remaining inflammation observed with regard to this cytokine is due only to anesthesia. So in conclusion, these cytokines and chemokines listed here were found to significantly change in response to hemorrhagic shock in our murine shock model. Furthermore, administration of this drug, TAC-242, successfully attenuated this biochemical immune response to shock in our model, in some cases possibly fully attenuating it. Ongoing directions for our experiment include increasing the sample size in order to parse out which of these differences are truly statistically significant. And then we're also working on developing a fixed pressure model of shock, whereas animals are held at a hypotensive pressure versus being subject to a fixed volume bleed, as this is one of the major limitations to our experiment as is. Furthermore, we're working on measuring the hemodynamic effects of our drugs in the shock state, which is, we have some promising preliminary results, but we don't have anything that we call statistically significant as of yet. And then finally, we will be examining the histologic effects, looking for markers of end organ perfusion. Be happy to take any questions at this time.